mentioned Carolyn and Jennifer, thank you for getting back to me right away and being so respectful and professional. God bless you. We all have issues at times where you're like, darn, what did I do? I forgot or something. You know, it happens to all of us. Don't you feel bad? It can happen. If you guys give me your phone numbers, which I got Carolyn's now and I got Jennifer's, but if you guys give me your phone numbers, I do kind of keep an eye on that, and I'll text you. Remember, tonight is the end of your, I do that. I know that's probably being too motherly, but, I figure you guys got a lot going on your mind, and you're pulled at so many directions that I try to help you just like you guys help me, when there's times, if there's ever a time where I might forget we started first instead of second, or you know what I mean, that kind of stuff. We have to help each other. So, and that goes out with you guys too, to help each other as far as, with your study buddies or whatever. Say, remember the test ends tonight, or remember, get that assignment in, or, help each other, because God knows you guys got a lot going on, don't you? Right? Yeah. So does that make sense to everybody? Yeah. Okay. Well, I hope that we're going to go ahead and start talking about nursing issues, chapter 3, and we're going to do culture then, chapter 4. We'll take a break, of course. So chapter 3 is a little lengthy, but I'm going to try to give you the bare facts. Now, and chapter 4 doesn't take as long, but also I like your input, I like your comments, so try to stay engaged. If you got radios on, or people are talking to you, or things are going on otherwise, you might want to remember that you're in the classroom now, and if you were at school, you wouldn't be able to do that. So pay attention, just like you would at school, because you're only hurting yourself, okay? And so remember your P's and Q's when you're in a classroom. Pretend that you're listening to a speaker. We have this our whole life. This isn't just in school. There's times that you're going to be listening to your whoever you work for. The boss is going to get a meeting, and everybody's got to get together. You got to sit and listen. It's always going to be there. You're always going to be needing to get your listening skills attuned and pay attention, because it is your career, not my career. Okay, you always keep that in mind. Who are you doing this for? Okay, so when you're thinking about stuff going on now, granted, listen, these days of ice and snow and COVID and kids at home, that could be a different, so there's always exceptions to the rule, but you guys know what I mean, right? When you have control over something and you can make it happen, you make it happen. Okay? And you guys remember that in the middle, when you're in second, and sometimes it feels like you've come so far, but yet, wow, I still got these big hurdles. You got to talk to yourself and say, why am I in this? Because I want to be a nurse. I know it's the right thing to do. I know it is what I want. I know what I will be doing, and I just got to make it through this. You talk to yourself and you say, it's worth it. Remember, your first degree is always the hardest. So LPN is by far going to be your hardest. I'm not saying that going for your RN is going to be a piece of cake. No, never in nursing is it a piece of cake. But it's going to be better than it is. This is going to be your hardest. This is going to be your most challenging. There's probably a lot of reasons why, but I don't know 100% why that is. I can tell you that with all my degrees, my first one was absolutely the hardest. And I was never knowing if I was going to make it from one day to the next. I was happy when I got 60s, a C on my tests. I was static, you know. Oh, good. Ming is in. Oh, she came. Okay. Yay. So you see what I mean, guys? So just keep these thoughts in your mind. You know, you got to talk to yourself. No, it's not. You're not mentally ill if you're talking to yourself. Now, if yourself starts answering and you're having a conversation, I don't know, you got to think about that. But no, you guys know what I mean. I'm trying to be funny, but is everybody with me? Am I hitting home to anything? To anybody? Okay. All right. So let's get this show on the road. I am going to turn my camera off while I do the PowerPoint. Remember, unmute and talk to me if you have a question or anything. There's Marquita. And let's see, Shaquita, I see, and is it Asa or Asia?
Asia.
What is it?
Like the continent, Asia.
Asia. Okay. And then Davy, well, I can't say her name, but God bless her. And Marilee, Carolyn, there's Jennifer, and Hannah, and Karina. Oh, what a pretty name. So, okay, I just wanted to say hi to the people that I could see right there, you know. I'm saying hi to everybody, though. So, all right, here we go. And you guys can turn your cameras off while we're doing this. But talk if you have anything. Okay. So we're starting off with, can you guys see that?
Yes, ma'am.
All right. So, okay, so first of all, when we're talking about issues in nursing, one thing that we want to talk about first is the health illness continuum. So remember that in everybody's health, we're on a continuum. And it's always shifting. It's never stagnant. It doesn't stay in one place forever. Now, picture this continuum. On one end is the highest level of health. And then all the way to the other end is poor health and even impending death. That's the health care continuum. And it'll move back and forth throughout all of our lives. Okay, so keep that in your mind as we're talking about things like this. Also, remember that we have a healthcare delivery system, and you know we have acute care, and then everything kind of stems out from our acute care in the hospital. Everything stems out from that, and that's usually places where a lot of us nurses work. The hospitals have a lot of these delivery systems connected to them. Okay, so it would be like rehab, home care, Of course, the ambulance, subacute care, long-term care, any kind of education, hospice, diagnostic centers, ambulatory surgeries, and then all the primary care offices. So, so the healthcare delivery systems. Okay, so when we talk factors influencing healthcare, that's big today. The changes in healthcare will and do impact your career. Now, the American population's increase in size of number of older adults, the baby boomers, and all the cultural diversity that we have, and all our I wanted to say upgraded, but all our technology, these are big factors that influence our health care. And the things are always changing. And we have evidence-based practice, like you guys learned in chapter 2, that also keeps us changing. We also have multi-drug resistant organisms that keep us on our toes because our treatments aren't working. So we have to learn new treatments, new medications. We have to come up with them. The people at that level that do that, ever changing, influencing our health care and how we do things. You know, why did we get these resistant microorganisms? 20 years ago, continuing on to now, doctors would give you antibiotics for viruses instead of for just bacterial infections. That's a big thing. I don't know if you guys even realize that, because in your time, that didn't happen as much. In my time, when I first became a nurse, you would get an antibiotic for everything. All you had to do was call the office and say, I got a cough. Okay, we'll call in amoxicillin for you. Well, we all know that doesn't happen today, especially kids. They need to be seen. You need to be seen. They got to see, is this bacterial? Is this viral? That's a big impact factor that changed. Okay, we find that we had to finish our antibiotics completely. That if you took 3 days worth and felt better and kept the rest of it for another time, that you're really screwed for the later on. That's why we got resistant organisms. These are all the things. We have new emerging viruses. COVID. We have public awareness for campaigns for human trafficking. And like I said, electronic health records. That was a big factor that influenced our health care and has made changes. We have the use of tablets and smartphones and digital apps. Well, now we got to worry about big time HIPAA and people taking pictures and putting stuff on their personal digital device. We have telehealth now, where you don't even have to go to the doctor because of COVID or other reasons, that they can talk to you over the phone. All of this are changes. I hope you're getting the point here now. Now, nursing informatics, if you like technology and you like nursing, you keep in there and you get your master's and you can specialize in informatics. And you will make big bucks and have a great job if that's what you like. So nursing informatics is another big thing that has changed through the years that we didn't have when I first became a nurse. Okay? All right. So, I talked about these things. Economic issues are big for factors influencing healthcare. You know, the changes in our insurance, Medicare. We have now Medicare A, B, C, and D because of all the things we had to add on to it. We have, since 2010, Patient Protection and Affordable Care Act. We have Medicare and diagnosing related groups. We have hospital-acquired conditions. We have mandatory reporting. And like I said, technology, all the things that I mentioned, evidence-based practice, resistant organisms. And then our population with the baby boomers. So we have an increased number of older adults now needing care. All of us baby boomers are retiring and getting to the age where we need assisted living and things like that. And then, like I said, our increasing cultural diversity. Any questions with those factors? Let's talk safe practice. So, when you hear safe practice, what comes to your mind right away? What is something that you might be worried about when you become a nurse?
Med administration.
The safety of the patient. Yeah, very good. Medication errors. Yes, very good. So we have all kinds of things that we've instituted for medication errors. We have the confused drug name list. You know, and if you stay updated in using your IT, you can save these websites and study them once a month or read them once a month and see if there's been changes. That is a responsibility that you take on when you become a nurse. To look at the drug list of the confused drug names. You have the do not crush list. You have drug names written with tall man letters. And that's because, I got this written down somewhere. Well, we're coming to it. You know, the tall man letters, that helps distinguish between drugs that look alike. We have error-prone abbreviations now. You got to know your abbreviations that are accepted. We have high alert medications. We have better ways to reduce medication errors, like using tape in a bright color on the floor, and they make a big square, and when you're standing in that square at the Pyxis and getting your meds, that means no one's supposed to be interrupting you. That is a practice that they've instituted to help save you from making errors with medications as you're preparing your medicines in the morning or throughout your shift, whatever shift you work. They have things like maybe a bright colored vest, that when you have that vest on, or a slash, that's do not disturb me while I'm giving meds. Because distractions during med administration will increase med errors. and you always have to stay focused and avoid interruption during those times. And if you're somebody who has ADD or ADHD, you got to be very careful and use these things that they have developed. Not just people with ADD and ADHD, all of us do. But you know, some people have more tendency to be distracted than others. Okay. So the other big thing would be we have sentinel events. That's where patient safety events that should not happen, like death and permanent harm. Okay, so we have a website for those things. We have the serious reportable events. Okay, so like surgical or invasive procedure events, product or device events, patient protection events, care management events, environmental events, radiological events, potential criminal events, all of the events from this National Quality Forum. It's identified 29 serious reportable events that should not occur in healthcare settings. And so they give you measures and safety tips and be safe type things. So this doesn't happen. Awareness. Okay, we talked, here's what I was saying, here it is, with the med errors. So remember, med errors increase with distraction. And then the interventions, and you talk to whoever you're working with and say, okay, I'm ready to get my meds going, don't, whatever, whoever your team is, don't interrupt me during this unless it's an emergency. Anything else can wait. If I ask you for something, go ahead and you can get that and give it to me. Other than that, you have to, I'm passing meds now, I got to really focus. Don't be afraid to do that. Okay. We have, like I said, the error-prone abbreviation list, the do not crush list, the drug name with tall letters, and the high alert medication. And there's the website for that high alert medication list. So, and these are the acquired conditions that they've studied to prevent. We want to prevent. So foreign object retained after surgery, air embolism, blood incompatibility. So all of these have measures and events or things, interventions that we do. And you guys will have in-services on and meetings to prevent these things from happening. Stage 3 or 4 pressure ulcers, falls, blood sugars out of control, catheter-associated infections, vascular catheter-associated infections, surgical site infections, DVTs, intragenic pneumothorax with venous catheterization. You don't really have to worry about that. It's just another example. So the significance with this is that at discharge, if any one of those conditions that we, like let's say a pressure ulcer, was not evident on admission, but is evident at discharge, the hospital will not get paid for any charges related to that. So that's why. And when this happens, people lose their jobs, nurses don't get raises, Okay, so it is very important. Is there any questions with the things I just went over? Okay. Oh, go ahead. Or did you say no?
I was just saying no.
What's that?
I just said no, ma'am.
Oh, well, thank you. Bless your heart for talking. I like to hear you guys. So, okay. And you know, obviously, you know, you can get into that. God, you can have great discussions about the things I just talked about. You know, and these are things like you will be getting your CEs on, like what after you're a nurse. There's going to be any of these areas that I might have mentioned, like in whatever you're doing, whatever specialty area, you might stay knowledgeable or get really more knowledgeable about things by doing CEs in it and keeping up your CEs, continuous education. Okay, so that's when you learn a lot of this stuff after you graduate. And that's what I did. I always try to do my continuing education on things that I'm interested in. All right, now this you do need to know. All right, now let me, the way you want to learn this is make sure you're able to do like matching with it. So let's say on one side you have the leadership styles written down, then the other side the definitions. Now in a test, you are going to be given like a statement and you need to find which leadership style goes with it. So it's going to be like matching. So that's kind of how you want to learn this right now. Okay, so let's start with well, first, before I get into the different types, leadership in nursing is very important. You being a nurse, that that in itself, you need to have good leadership skills. So you want to think about different leadership styles. Remember, a leader seeks to influence and motivate and enable others to achieve their goals. You can be a leader of your team, a leader of your unit, a leader of the hospital. You can be a leader in your career in many ways. Leadership skills are necessary for you to effectively guide patient care and achieve your patient care goals. You are the leader. You are who the patient and the patient family looks to for guidance. That's a leader. You are a leader just by becoming a nurse. So effective leaders in a healthcare setting has to be knowledgeable. They have to be knowledgeable about management and supervisory processes. They have to be able to use critical thinking and be able to make decisions. And if you know people who haven't made it quite in nursing, this is part of it. Because to be a nurse, you got to be able to do this. You got to be able to critical think. You got to be able to make decisions. And as a nurse, you're a role model. And you provide inspiration to your patients, to family, to other peer workers, co-workers. And remember, a positive attitude and a sense of humor. That's why I like to have fun when I teach. I like to have a sense of humor. I don't want to be so serious all the time. And believe it or not, they have found that positive attitude and a positive with sense of humor, those are awesome attributes for a leader. And if you think about any teachers that you have or have had, instructors, sometimes you learn the most by the ones who are positive and make you feel worthy and give you good vibes and smile. Along with they have a sense of humor that you can feel like you can laugh with. Those are things you want to keep in your mind about leadership. So ultimately, a leader is going to earn the respect of their coworkers to be successful. If you don't have respect, people are not going to follow you. Why would they? Why would they? So you really, in the long run, will need to have the respect for people to want to follow you and listen to you. Otherwise, they roll their eyes and like, oh my God, here she or he goes again. Okay? So that's why we're going to discuss learning styles. So there are 3 traditional leadership styles, which is autocratic, democratic, and laissez-faire. And then they've added a fourth leadership style, which is called coaching. So those are your leadership styles that you might want to write down on the side of your paper, that you're able to recognize a statement or a definition or several words that you know, oh, this is describing autocratic. Oh, this is describing democratic. Oh, this is describing laissez-faire. Oh, this is describing coaching. Okay, and that's what I'm going to help you with. Okay, so let's start off with autocratic. When you hear autocratic, you want to think that the leader has a high degree of control. A high degree of control. That's autocratic. Authoritarian. Authoritarian leadership. So in other words, there's almost no control given to others. The leader has the control. So the leader determines the goals. The leader plans for achieving those goals. Others are told what to do. They're not asked to provide input. They're told what to do in an autocratic leadership. Now, yes, the group can achieve high quality outcomes. That's the positive thing. That's the advantage of this. Yes, there can be high quality outcomes from this style of leadership. It is an efficient leadership style, especially in an emergency situation. So you might want to remember that this type of leadership is great for an emergency. So the leader takes control. In ER, emergencies happening, you do this, you do that. You guys are patient codes. The leader takes over and delegates everything. That's an example of someone who's a leader in using autocratic leadership style. Now the disadvantage is there's no participation. You just do what you're told. And that can be a problem. Okay? Everybody got that? Okay? All right, now democratic. Now, here's how I want you to think. You've got autocratic. Next in your mind, think democratic. It's the opposite. Because there's two other ones that you could get confused with democratic. But if you listen to what I'm saying, you won't get confused. You think there's either autocratic or democratic in your mind. Autocratic, the leader takes control. Democratic, that means that the leader has a moderate degree of control, but others are given control and freedom in a democratic leadership. So participation is encouraged. And that's what you want to remember. Different than autocratic, in democratic, participation is encouraged. And you're involved in determining goals. And you're involved in plans for achieving those goals. Decisions are made within the group. Everybody talks about it. The leader just steers the group. The leader is at the steering wheel, but the others are involved. So the leader assists the group by steering and teaching rather than dominating. And the leader does share the responsibility. Now, this also has achieve a high quality outcome in this type leadership. With this one, it's more creative under this leadership. More creativity can happen under this leadership. And with this leadership, there's high participation leading to more satisfaction and motivation among the members. So you can see the difference, right? Autocratic, democratic. Now, one disadvantage to the democratic is it takes more time then. Anytime you have people involved, and it's just not you, because you got to get them to be involved, it takes more time. You know, setting up, planning, setting goals. Let's hear from everybody. Let's get everybody's ideas. Takes more time. Make sense?
Yes, ma'am.
Okay, so let me ask you guys. Anybody can answer. You have a client, and they're in cardiac arrest. Now, the nurse leader quickly responds to the emergency and assigns clear, defined tasks to the work group. What type of leadership style is she implementing? Yes, autocratic. Very good. Autocratic. Wonderful. Okay. All right, let's move on to the next one. Okay, so now laissez-faire. It's a decorative, in other words, delegative. Laissez-faire. And you can see why people get laissez-faire kind of mixed up with democratic. But if you think of in democratic, it is the opposite of autocratic, but it still has the leader in Democratic still has some control. They're still there leading. They're at the steering wheel. Now in laissez-faire, the leader has no control, exerts no control. It's all delegated, 100% delegated. So the group, therefore, is given complete freedom. Do you see the difference?
Yes.
Good, good. So with laissez-faire, the leader exerts no control over the group. There's complete freedom for decision making. In laissez-faire leadership, no one is responsible for determining goals and plans. The whole group is. Not one person is. The whole group is. And this one can give you a little feeling of chaos. And often a little bit is produced. There's not as much accomplished in this type of leadership. Little is accomplished. Work quality is known to be more poor with this type of leadership. So the quality of the outcomes can be poor. The advantage is that you're self-directed. You do your thing, baby. Highly motivated group because nobody's over you. You got freedom. And in some ways, if you're really good and you're motivated, you don't really need anybody telling you what to do. All right, now coaching. Now coaching is emphasized by active listening. Now you didn't hear that word with Democratic, did you? When you hear coaching, you want to focus on the leader is actively listening, has quality communication, support, and accountability. Now, the coach, think of if you've ever been on a team and you've had a coach. The coach works with the others to develop problem-solving skills and facilitate critical thinking. So the coach works with you on your skills so that you develop the problem-solving skills and critical thinking. Do you see the difference between that and Democratic? In Democratic, the leader will want you to be involved, but they're not going to coach you on it or work with you to develop your problem-solving skills. That's coaching leadership. You see the difference? In Democratic leadership, it's just that your group is involved, but you're at the helm. In coaching, you are the leader, but you're focusing, listening, communicating, and helping, teaching, coaching them to develop their problem-solving skills and critical thinking. Now, with this type of leadership, a good thing about it is the staff feels more empowered. The more you learn, the more you feel like you're making headway, that makes you feel empowered. Wow, I never was able to problem solve the way I am now. And I got that because of my leader. She's great at developing, helping me with my leadership skills, my problem-solving skills, my critical thinking skills, me being able to prioritize my day. She's helped me. She's making me think. again, and I shouldn't just say she, he too. And again, though, this takes time, so that's a disadvantage. But with coaching, the group feels empowered, valued, respected. All right, any questions with that? All right, let me ask you a question. So if you're a nurse manager and you're actively listening to your nursing staff and you're encouraging them to be accountable for their patient care, what leadership style are you demonstrating?
Democratic.
No.
Coaching.
Coaching.
Coaching. What words did you pick up that made you say coaching?
Accountability.
Active listening. I said the nurse manager is actively listening to the nursing staff and encourages the staff for them to be accountable for patient care. That's coaching. As opposed to democratic would be that she does listen, he or she listens, but more just getting their opinions. So what do you think? Okay, so let's run through these. Okay, here's autocratic. Okay, oops, I lost you. Hang on a minute. Okay, here's I'm putting my camera on here for a second so I can talk to you. All right, here's autocratic. Davy, you go get the ambu bag. Karina, start the IV. Carolyn, go get the ADI or the, wait a minute, what's the thing with the, you know, that shaksha?
AED.
What is it?
AED.
AED. Thank you. Thank you. You guys just witnessed one of my learning disabilities. My the letters. I'm terrible at that. Terrible. And it has to do with the learning disability. I could tell you more stories, but anyways, okay. So what is that? What leadership did I just give you?
Autocratic.
Autocratic. Okay, now. Okay, let's all. Team, we need to get better with our getting these patients out of bed and getting them moving. We've gotten some bed sores here and things are happening. Let's have a meeting. Okay, so now we're all in the meeting. Okay, you guys, now our goal today is to discuss and get important strategies on helping lessen or reduce our immobility complications that we're seeing. Okay, so anybody have any opinions on this? Yes, what do you think? Yes, what do you think? Hey, that's a good idea. Okay, now what am I demonstrating? Democratic. Okay, very good. Okay, now. All right, hey you guys, we need to, everybody has to get better at getting in here at 8 in the morning. Okay, all right. So whatever you guys want to do, just make sure you're here by 8 in the morning. What's that?
Laissez-faire.
Laissez-faire. No control. You guys got the control. I'm not giving you anything. You just do it. You know, laissez-faire, self-directed. Carolyn's got to figure her way to get in here at 8 o'clock. Brittany has to figure her way to get in here at 8 o'clock. All right, now, what about this one? I am actively listening to my group. No, now you tell me what you think. No, yeah, but why? What is that? How's that going to help? How are you going to get this more in an efficient manner? Okay, yes, yes. What am I doing?
Coaching.
Coaching. See the difference? Can you see, though, why people get confused on democratic and coaching? Laissez-faire, I think you should be able to get that one. There's no control. But you got to think and watch for those key words. Active listening. When you hear active listening, you want to think coaching. Okay. All right. We'll move on now. Hopefully that helps you. All right. I'm going to, oh, wait a minute. I want to see if somebody said something here. Oh, Lakia is here. Good. Good. Thank you, doll. I will mark you down. All right.
Right, I'm here also. This is Erica Sibley.
Yay, Erica. Thank you, sweetheart. I'll mark you down.
Okay.
Okay.
This is Rahel. I'm here too.
Oh, well, you know what? This is awesome. Everybody's here. Yay. Thank you, sweetheart. Yay. Amen. I'll mark you down too. Okay. So you want to remember them in a matching type thing. Listen, one of the keys of being successful on a test, and this is my NCLEX experience coming out, all my, and you know, and you guys, when I say stuff about myself, trust me, I am not, this isn't about an ego, me bragging. I am just telling you kind of like that you know that you want to listen to me as far as I'm an expert. I am actually considered an expert when it comes to Kaplan decision tree test taking skills. Okay? So when I say you want to pick up key words, that's going to make you more accurate when you're taking your test. Look at the words, slow down, read carefully. What are they asking you? What key words are going to help me get the topic right to lead me to my answer? If you start doing that right now, all the time, and you're thinking that way, instead of what you've been programmed for years to read a question, answer in your head, look for it, there it is, that's my answer. Doesn't work. You don't read, think of an answer, there it is. Because when you read a question that's a scenario, you got to critically think, because the answers, first of all, the one that you were thinking might not even be there. And second of all, there isn't just one answer, but you want the best answer. It's not right or wrong. All of them are right. So keep that in your mind all the time. You'll get better at test taking. Okay, now, next thing is management function. Okay. This is also another one that you want to do as matching, as learn it in a matching way, because that's how you will be tested on this. So you want to write down the management functions on one side and then be able to pick up a phrase or words or a characteristic in the words that you know. Oh, that's planning. Oh, that's organizing. Oh, that's directing. Oh, that's coordinating. Oh, that's controlling. Because those are your management functions right there. And we're going to talk about each one. There's 5 major components in management process: planning, organizing, directing, coordinating, and controlling. Now you're going to see some similarities to the nursing process. Okay, but this is in management. For you to be able to function in management, you use these components. I hope that makes sense. Okay, so planning. Let's talk about planning. The one thing that I want you to remember, that it's the first step. And if you remember that word right there, you're going to get it right on the test. In the matching form, you're going to see first step. Oh, that's planning. So planning is the first step. It organizes. It helps with the organization of your care. So in the first step of the management process, a plan must be developed to ensure that the desired patient care outcomes are achieved. So to formulate the plan, desired outcomes or problems are identified and data about them are collected. So a decision is then made about the best option and the course of action. And the leader should ensure the choice is realistic and it can be implemented. In planning, you will involve the others in the planning and the decision-making process. But the one person that you want to remember that you're going to involve is the patient. Involving the patient increases the smoothness of the implementation. If you're involving the patient, when it comes time to doing the implementation, the patient will be better. It will go smoother. So, planning, the first step. Organizing is the second step. Now, you may not see second step or third and fourth. You're not going to see that maybe on the rest of them. Okay, so don't think that that's going to be the key that's going to get you, but it will with the first. All right, organizing is, though, the second step. And the purpose of organizing is to provide an orderly environment that promotes cooperation and goal achievement. So what I want you to remember with organizing is that that is what provides an orderly environment, an organized environment to accomplish your goal. So, policies and procedures provide this framework. So you want to think policies and procedures when you think of organizing, because they provide guidance to carry out the task to help accomplish your goal. So in organizing, that's where your policy and procedures come into work. They're the framework for your goals and your activities. So organizing provides an orderly environment to accomplish the goal. Policies and procedures is an example. All right, directing. Directing is the third step, and that's when you make assignments. You're making assignments in directing. That's your primary function in directing, making assignments for the staff or whoever you're directing. And remember, communication is important in directing because assignments need to be clear and specifically stated. Okay, that's directing. Coordinating is the fourth step. Coordinating, and this is where people can get this confused, that's the process of looking at a situation to ensure that it is being handled in the most effective way. So coordinating services for a patient. So the nurse might assess a particular, yes?
I'm sorry, can you repeat that?
I sure will. So coordination is making sure everything is handled in the most efficient way possible. You're coordinating everything. You're coordinating the services of the patient to make sure that everything is getting done right, the most effective way. So in this, you might assess a particular activity or an issue related to a patient care assignment when you're coordinating. So you're looking at the situation and you're trying to ensure that everything is handled correctly. So you might assess a particular activity or an issue related to the patient care assignment. Now, in a long-term care facility, for example, the nurse might review the skin assessment and care throughout the facility to see if it's being done consistently, uniformly, and its most effective way. And then if a concern is found, then problem-solving techniques are used to fix it. That's coordinating. Making sure everything is handled in the most efficient way possible. Think of a wedding planner. All the things that are going on to get a wedding to get to its best. Okay, now it's the day and everything goes off without a hitch because of the coordinator, the wedding planner. Does that make sense?
Yes, ma'am.
Good. All right, now controlling. Controlling is the final phase, and you might want to remember that words for controlling. Maybe that'll help you with not getting it mixed up with the other C, coordinating. Controlling is the final phase, the fifth step, the final phase of the management process. And you are evaluating the accomplishment of the organization's goals. So that would be like quality improvement. So you're controlling the quality through quality improvement. So you are involved in quality improvement to make sure that the organization's efficiency has the ability to reach its goal. So you are controlling to evaluate the accomplishment of the organization's goals. Quality improvement, and it must be continuous. Just like evaluating in your nursing process, you're doing it all the time at every step. Same with controlling. Controlling, you are doing it continuous. Continuous quality improvement is linked with controlling. That's your final phase. Okay, any questions? Oh, and I did write these out here, so we'll just review them real quick. So your planning is your first step. That's when you organize the care and the care given, and you're going to involve the patient to increase the smoothness of the implementation. Organizing is the second step. That's when you provide an organized environment to accomplish the goal, your policies and procedures at your facility. Directing, you're making the assignments for the staff. That's directing, the third step. Coordinating is the fourth step. You're making sure everything is handled in the most efficient way possible. You are the wedding planner for your patient or your department. Depends on, what it can go in. You can see management functions can go in different jobs.
I have a question.
Yes.
Is directing the same as delegating?
Yep.
Okay.
Yep.
They're always talking, well, my supervisor's always saying,
yes,
delegate, because that's one of the things. So, but.
Yes.
Okay, so it's the same thing.
In management, it's called directing, but you're delegating. In nursing, we call it delegating.
Okay.
Uh-huh. Yep. Yep. And then controlling is your last step. It's continuous quality improvement. So controlling quality continuously through quality improvement. Okay. Any questions? Let's take a look at the time here. At 9:30, we're going to take a break. So we're going to go a little further. Okay, everybody all right?
Yes.
Yes.
Yeah. Did you say yes? I think you said yes.
Yeah.
Okay. All right. I know it'd be nice to take one now. I want one too, but let's get a little further so we can get through with what we need to get through. Yes, I'm a autocratic leader, huh? No. Okay. So now we're going to discuss the role of leadership for you as the LPN. And yes, this involves delegation. All right. So first, you want to remember that I said this, but as an LPN, you are a leader and manager of care for your patients to whom you are assigned. Now you're under the supervision of the RN and the healthcare provider as the LPN and maybe the dentist, okay, if you work for a dentist. And everything is specified in your Nurse Practice Act. Okay, so you have to follow your state Nurse Practice Act on the things that you're allowed to do, your scope of practice. But yes, you are a leader. You are going to be a manager. You are going to delegate. Now, an LPN might function as a team leader or a charge nurse, often in the long-term care setting. And you are going to be delegating to unlicensed assistive personnel. When you act as the team leader or a charge nurse, an RN delegates the authority to provide supervision and delegation of the tasks. So the RN would be providing supervision. Now, team leaders are responsible for the coordination and delivery of care for each of the patients that they're assigned to. And the team leaders receive information from the team members and communicate patients' needs appropriately to the correct or right individuals. And because team leaders guide patient care provided by the team, the team leaders have to be knowledgeable about safety. And you have to be knowledgeable about the policies and procedures and the patient rights. And you have to take accountability of being a team leader. So one thing I want you to remember is that you need to review your state Nurse Practice Act, and you have to continuously stay up on that so you're staying within your scope. Remember that when you delegate, that's the act of empowering another person to act. You're going to delegate this task. Now it is their responsibility to get it done. But you are accountable for who you delegated it to, and that, everything that you delegated it to the right person, but the person who is the delegatee is accountable and responsible for accomplishing that task. So, within the leadership role, you as an LPN, you must decide when delegation would most benefit the situation and the patients. You follow your Nurse Practice Act. In other words, you follow your scope of practice when you're making any decisions regarding delegation. So there's going to be questions that you're going to follow, like, does my state Nurse Practice Act allow for delegation in this situation? Does the person who I'm delegating have the knowledge and the education to perform that skill? And is it not only does she say or tell you she is it documented that she is, he or she is? And would it benefit the patient if I delegate this skill to that person? Okay, so when you are delegating, You are going to know your State Nurse Practice Act rules. In other words, stay in the scope. Now, the LPN scope of practice usually does not provide legal authority for an LPN to delegate. That's why on your test for your boards, they say the only person who can delegate is the RN. Okay, formally. So I'm going to say that again. The LPN scope of practice usually does not provide legal authority for you to delegate. That only the RN can delegate. However, some state board rules will allow you, as the LPN, to delegate tasks that are within your scope of practice, as long as the RN has given you the authority to delegate those tasks. So you always will have the RN supervising you, but make sure that you know when it comes to NCLEX, the RN is the only one that can delegate. Does that make sense? So in other words, there are going to be things you as the LPN will ask your unlicensed assistive personnel to do. And as long as it's within your scope, within the scope of your assisted personnel, and the RN is supervising, you're okay. Does that make sense?
Yes.
Okay. All right. So yes, you will follow those 5 rights of delegation. You're going to see them coming up here in a minute. Okay, so let's talk about some tasks. So when you do tasks, some will be collaborative tasks and some will be independent tasks. When it's collaborative, that means care provided that needs 2 or more members of the team to legally accomplish it. So this will be in with your RN. You're collaborating with your team. You aren't doing it independently. You're doing it. So in other words, let's just look at the nursing process. In the nursing process, you assess/gather data. You plan, and in your planning, you set goals and interventions. Then you implement. Then you evaluate in your nursing process. Well, in that nursing process, when you're gathering data and assessing, you are collaborating with the RN and with your team. You do not do that independently. You can gather data as the LPN in your scope of practice, but any information that you gather, any data that you gather, you have to report it to the RN because she assesses what you gathered and makes the decisions. This is the way it is in NCLEX world. Now, in the real world, you will not see it that way because LPNs do so much. But if you're really looking at it under a microscope, really the LPN is still, even in those situations in the real world, is doing under her scope. But when you're taking your NCLEX or you're thinking NCLEX, It's going to be a little bit more strong. It's not going to be so gray. So, again, in the first step in your nursing process, LPNs gather data. They take the data to the RN. They're collaborating as a team. The RN then assesses what the LPN gathered and makes the decisions. That's collaborating. Same with the planning. The LPN and the RN collaborate. The plan for the patient, set the goals together, set the implementation steps, what we're going to do for this patient. Now, when it comes to implementation, that step the LPN can do independently within her scope. So that means that's an independent task. She provides direct patient care under the supervision of an RN or healthcare provider or dentist. But you can independently provide patient care. So that is the only step in the nursing process that you can do on your own as an LPN. Patient care, direct patient care. The RN does a lot of indirect patient care. Now, then evaluation comes back to the team again. You cannot evaluate by yourself. You can gather data, what you evaluated it, give it to the RN, and then together you guys collaborate. Does that make sense or help you understand that part?
Yes.
Okay. Good. So, again, this is just all repeat. Delegation is the act of empowering another person to act. It does occur in a downward manner, Dr. RN, LPN, UAP. Responsibility is passed to the individual. The task is delegated to, but accountability remains with the individual who is delegating the action. The person who is getting the task is responsible for completing that task, but whoever delegates it has to take accountability that you have delegated it to the appropriate person. Appropriate patient. So know your state practice act, identify the skills, always of the delicatee, and make sure that there's documentation to prove that they can do that they are certified in that. And use the 5 rights. And here are the 5 rights. The right task, under the right circumstances or situation, delegating to the right person that's able to do it, providing the right communication, clear, concise, complete, and with the right supervision. Under the supervision like the RN. Okay? And then with our healthcare team, there's the certified nursing assistants. There's, of course, LPNs and LVNs. on your, if you went to a vocational school or a technical school. Registered nurses, certified registered nurse anesthetists, certified registered nurse practitioners, clinical specialists, certified midwives, doctors of nursing, physicians, physician assistants, pharmacists, social workers, dietitians, physical therapists, physical therapist assistants, respiratory therapists, respiratory therapy technicians, occupational therapists. They also have assistants with them, speech and language pathologists, health unit secretaries, and student nurses. Okay? Any questions with what we just covered? Okay, now we are going to take a break before we start talking about ethics. So I beat the 9:30 mark. Yay! Okay, so it is 9:25. Let's say. Let's take 15 minutes. Okay, so what's that make that? 9:35, correct? I'm right, aren't I? Okay, so I'll see you guys
15 minutes to be 9:40.
Oh, 9:40. Okay, thank you, darling. Okay, so I will see you guys at 9:40. Sound good? All righty. See you then.